surgery has side effects. I mean, I have a family member had knee surgery, and holy smokes, they found a blood clot. And it was just routine. This is what they do, and it was very dangerous, and he could have died with that. Do all the processes have that risk, or is there less risk in not actually in doing whatever you do? Can you explain what it is you do? So you're not like rubbing a rock on it. What are you doing?
Well, first of all, you mentioned surgery. I am still a surgeon. I'm fellowship trained in sports medicine, orthopedic surgery. You're right. There are potential complications with knee replacement or any surgery we do.
Sure.
And so blood clots are a huge risk after a knee replacement. If you don't do some type of preventive thing like aspirin or some type of blood thinner, at least 80% of people are going to get a blood clot.
Yikes.
Now, if you get a blood clot in your leg, that's painful, it's swollen, it hurts. But if it breaks off and goes to your lungs, that's called a pulmonary embolism, a PE, and that can kill you. It hurts, it can kill you. So we do put people on blood thinners, but that carries a risk as well. You can have bleeding.